All right, we're going to talk about key areas of injury in the knee for children. So we talked about how there's a lot of compressive forces in standing for adults, and then for flexion, it's in patellofemoral pain. That all still applies to children. It's all the same forces. The difference are the structures and where the weak spots. So you're going to hear me talk about almost every injury that I get to you, or every joint that I get to in this class, is that when we see a lot of like soft tissue, tendon, ligament type of injury at a joint in an adult, you're going to see the bony aspect of where they attach being the injury. So avulsion fractures, chondral issues, because the bone is still growing and it's soft and pliable. And if there's open growth plates, it's the weaker spot compared to that strong tendon, muscle, ligament, whatever is attaching there. So for the knee, patellofemoral pain still applies. There still can be pain in children in the patellofemoral region because it is still taking on a lot of force, and it has to do with the landing mechanics and the strength of the other muscles, especially with the quad. And with the sensory motor system building. So there's some other factors that are different than adults, but that can still exist. Now, where we would normally talk about patellotendinitis, that's going to be very different. The patella tendon attaches at the tibial tubercle. And if you remember, there's epiphyses. Epiphysis is the open growth plate of a long bone, and where there's a secondary growth center where there's like an attachment point at a tubercle or an epicondyle, that is going to be apophysis. So this is apophysitis. So this is also referred to as traction apophysitis because what's specifically happening is there's an open growth plate here where the tibial tubercle is growing out. And this big thick tendon is there, and this is in jumping athletes or people are doing a lot of repetition. I commonly saw this in athletes that are transitioning from soccer on grass to basketball on a hard floor and doing a lot of jumping and doing probably too much for their age, doing two sports at once, or they're doing travel, school, and another league all at the same time. So with that said, that tendon is really pulling on that spot where it's attaching, and it's an open growth plate, so it's weak. It's not, it's filling in with cartilage, and so it just widens. So that growth plate then widens and it's pulling traction on it, and it fills in with this extra bone. So anyone who's had that, it's called Osgood-Schlatters, and the pain goes away, but the bump stays forever, and that's because it filled in with bone. And then another spot I want to talk about is the medial compartment. This is another major area of load in the knee, and in a child, where an adult, the cartilage, the articular cartilage, might break down, but it takes time over time. It doesn't like acutely usually just fall off and get a defect in there as quick as it would for a kid. Now, a kid, where normally we'd have that twisting injury, and it would tear the meniscus, and a child, it's going to tear the cartilage. It's going to cause the cartilage to pull that subchondral bone, so that nice pliable um, uh, very collagen formed bone that's nice and soft, is going to pull that off with the cartilage. That's called an osteochondral defect. Osteobone, chondral, cartilage, so a mix there, a defect, and it's like floating around. Sometimes it stays attached, but if it's floating around, it will start roughing up the surface of the articular cartilage and cause very significant damage. So it's very important to recognize that. That can happen acutely or chronically in a child. So acutely, it would be the same mechanism as the meniscus here, where you're running and you suddenly change direction and you do that twisting. I had a squash player who did that, which is like racquetball, where you change directions really quickly and acutely tore that. And also you see it a lot chronically. And I want to remind you, it's medial femoral condyle. It can happen anywhere, but the most common spot for this in the knee is the medial femoral condyle because of that load going through the medial side. So for chronically, it's gymnasts. Typically, it can happen to a lot of people, but gymnasts landing in that constant extension where there's extreme compressive forces. So just when we're going upstairs, an extension that's 4 times our body weight. So when we're landing from something like a vault or something, or a floor routine in gymnastics, it's significantly more. And so over time that will break down and the blood supply will start to die away, and sometimes the bone will start to die away, and that's where it breaks off really easily. That can be something more significant that we call osteochondritis dissecans, but it still develops into osteochondral defects, and that's what I want you to remember for this class. So an adult, we might have a meniscus tear acutely, but with that twisting mechanism, but in the child, we're going to have osteochondral defect. And then over time with that repetitive landing and jumping, we'll have a breakdown of the cartilage in an adult and the breakdown of the meniscus in an adult, but in a child, it's going to be that osteochondral defect. So those are the main differences in the knee with a child versus an adult. If you have any questions, reach out.